Hola amigos, feliz viernes. Hoy es viernes, yo soy Rory y estoy contento de estar aquí contigo. Hoy estamos conversando sobre dolor de cabeza en español. So we're talking about headaches, some anatomy around them, symptoms around headaches, warning signs with headaches, and I'm going to give you some general basic descriptions of a handful of common causes of headaches. So let's go ahead and dive right in. Before we get started, there are two lessons that I have given over the years that might be interesting to you that will help you with this topic of headaches. First of all, it's a lesson specifically on pain, and then secondly, a lesson about history of the problem as you're talking to your patient about how things started, when they started, what you were doing when it started, all that sort of stuff. These links are, so these blog posts are linked up in the blog post today. So be sure, if you're watching this video on YouTube, before you like and subscribe, after you like and subscribe, head on over to the blog post so that you can see the post there, get the notes and everything, and head off to these additional posts, related posts also. Okay, let's get started with Anatomia Básica when it comes to headaches. So we've got el cerebro, brain, el cráneo, this is like the skull, the bone structure. El cuello is neck. Nuca is often referred to as the back of the neck. El cuero cabelludo, this is the scalp. El pelo, el cabello, hair. La boca, mouth. La cabeza, head. La mandíbula, jaw. La nariz, nose. Los hombros, shoulders. Los músculos, muscles. Los oídos, ears. Los ojos, eyes. Y los senos nasales, so the sinuses. Okay, so that's some basic anatomia that may come up in your descriptions and your conversations around headaches. Let's start looking at some signs and symptoms of headaches. So primero, ansiedad, anxiety. Aura, or perturbaciones visuales, or cambios de visión, or cambios en la visión, so changes in vision. So aura. Perturbaciones are like disturbances, so visual disturbances. Depresión, depression. Dolor, pain. And here are some specifics about pain. Dolor ocasional, so like occasional pain. Dolor frecuente, frequent pain. Dolor leve, like a light pain. Dolor moderado, moderate pain. Dolor intenso, an intense or severe pain. Dolor con presión, like a pain with pressure. En un lado o en ambos lados. So en un lado, on one side, or en ambos lados, on both sides. Estrés, stress. Falta de sueño, lack of sleep, or no dormir bien, not sleeping well, or no dormir lo suficiente, not sleeping enough. Okay, continuamos. Más signos y síntomas. Fiebre, fever. Gripe, the flu. Náusea, nausea. Presión alta, high blood pressure. Problemas de memoria, so memory problems. Resfriados, like a common cold. Sensibilidad a la luz, so sensitivity to light. Sensibilidad a ruidos, sensitivity to noises. Somnolencia is like feeling sleepy all the time. Vómito, vomiting. Okay? All right. Now, well, those are some basic síntomas, and maybe some of those could be concerning, and others might be less concerning. But here are certainly some concerning, or what we might consider warning signs of headaches in español. Caída de la cara, so a droop in the face. Convulsiones, seizures. Debilidad, weakness. Debilidad o rango de movimiento limitado en un lado. So weakness or limited range of movement or range of motion on one side. Desorientación, feeling disoriented. Dificultad para hablar, difficulty speaking. Dolor de cabeza después de una lesión en la cabeza o una caída. So headache after a head injury or a fall. Dolor que empeora a pesar de tratamientos. So pain that gets worse in spite of treatments. Dolor repentino y muy intenso, so sudden pain and intense pain. Dolor y rigidez en el cuello, so pain and stiffness or rigidity in the neck. Entumecimiento, so a numbness, feelings of numbness. Fiebre, fever. Problemas con el equilibrio, problems with balance. Problemas de coordinación, so problems with coordination. Sarpullido, like a rash or hives, hivey type rash. Visión doble, double vision. Okay. Hey, are you learning something new? If you are, please like, subscribe, share these videos on YouTube. That's how we're able to keep going when you are able to interact with the video, comment, etc. All these things kind of help the algorithm, help other people see us who are working on their medical Spanish, and that's how we make a bigger difference in communities across the country. So before you move on from this video, be sure to like, subscribe, and share, comment, all the good things, okay? All right, muy bien. Let's move into causas comunes de dolores de cabeza. Tensión, estrés, so tension, stress, and it's kind of long, so stick with me. I'll explain it as we go. Tensión en los músculos de los hombros, so tension in the shoulder muscles, el cuello, the neck, la mandíbula, the jaw, y el cuello cabelludo, the scalp, pueden provocar dolor de cabeza, can cause headache. El estrés, stress, saltar comidas, skipping meals, tomar demasiado licor, drinking too much, deshidratación, dehydration, y no dormir lo suficiente, and not sleeping enough, pueden contribuir a dolores de cabeza de tensión. So all those things can contribute to tension, headaches. Okay? Migrañas. Las migrañas son un dolor intenso o punzante. So migraines are an intense pain or throbbing pain, stabbing pain que empeora gradualmente, that gets worse gradually. Puede empezar en la frente, it can start in the forehead, en un lado de la cabeza, on one side of the head, o alrededor de los ojos, or around the eyes. Pueden ser acompañadas con cambios de visión. These could be accompanied with changes in vision, náusea, vómito, nausea, vomiting, sensibilidad a la luz y ruidos, and sensitivity to light and noise. Dolor de cabeza en racimos. Dolor de cabeza en racimos, cluster headaches. Un dolor de cabeza repentino, so a sudden headache, y muy fuerte, it's strong, sudden and painful headache. Pueden atacar un lado de la cabeza o detrás de un ojo. So these can attack one side of the head or behind an eye. Pueden despertarlo en la noche. These can wake you up at night. Son parecidos a las migrañas y pueden durar hasta 3 horas. So these are similar to migraines and can last up to 3 hours. Okay, let's keep going with causas comunes. Now, if you have other things that you want to say about these kinds of headaches or other related topics, just use the comment section, put your comment in there. We see them, we get notified, and we'd be glad to respond to you with our perspective on it, okay? Más causas comunes. Dolor de cabeza por sinusitis, so sinus headaches. La congestión que tiene una infección e inflamación de los senos nasales. So congestion that has an infection and inflammation in the sinuses durante un resfriado, during a cold, pueden provocar dolores de cabeza, can cause headaches. Conmoción cerebral. Okay, this is a biggie. Conmoción cerebral, concussion. Una lesión al cerebro causada por un golpe en la cabeza. So this is an injury in the brain caused by some sort of hit or bump or trauma to the head. Por el golpe, because of this impact, el cerebro mueve violentamente hacia adelante y atrás. So because of this impact, the brain moves violently back and forward. Este movimiento hace que el cerebro golpee al cráneo. So this movement makes the brain bump up against the cranium y puede provocar convulsiones and can cause seizures. Somnolencia, sleepiness, confusión, confusion, pérdida de conocimiento, loss of consciousness, pérdida de conocimiento, loss of consciousness. Es importante un tiempo de reposo y no volver a golpear la cabeza. So it's important to have a rest period. Tiempo de reposo is reposo is kind of like the same term that you might use with a pregnant mom who's having some dangerous symptoms like bed rest. So reposo is that same term. So es importante un tiempo de reposo y no volver a golpear la cabeza. So time for rest and not continuing to have any injuries or hits to the head. All right, continuamos. Un accidente cerebral. Accidente cerebral is kind of like the general term for a stroke. Los accidentes cerebrales también son conocidos como derrame cerebral, also known as derrame cerebral, another word for stroke. Pueden ser causados por sangrado, so they can be caused by a bleed, o falta de sangre, or lack of blood, en una parte de la cabeza, in a part of the head. Resultan en confusión. I suppose that should say cerebro, right? Instead of cabeza, but you get the idea. Resultan en confusión. They result in confusion, debilidad, weakness, dificultad para hablar, difficulty speaking, somnolencia, tiredness or sleepiness, entumecimiento, numbness, etc. Es una emergencia. It's an emergency. Problemas de la visión. Si una persona tiene problemas de visión y no usa lentes o lentes de contacto, tiene que esforzarse para ver. So, vision problems. If a person has vision problems and doesn't use glasses or contact lenses, they have to strain to see. Esforzarse, strain para ver. Este esfuerzo, this straining, extra, puede provocar dolores de cabeza. So this extra straining can cause headaches. Okay, let's talk a little bit about exámenes y procedimientos to diagnosticar and get a better idea of what's going on with these dolores de cabeza. So, para diagnosticar, obviamente examen físico, tomografía computada, TAC, so CT scans, resonancia magnética de cabeza, so MRIs of the head, angiografía cerebral, so a cerebral angiography, electroencephalograma, so electroencephalogram, that's a tough one, electroencephalogram, EEGs, okay, muy bien, excelente. Sugerencias para ayudar, so some suggestions for your patients to help with their headaches. Cambios de estilo de vida first, so some changes, lifestyle changes first. Bajar el estrés, lower stress. Aprender maneras para relajarse, learn ways to relax. Tomar medicamentos de venta libre, taking over-counter medications. Venta libre, medicamentos de venta libre is how you say over-the-counter. Okay? AINES, antiinflamatorios no esteroides, como ibuprofen, etc. Okay? Descongestionantes, decongestants. Evitar los desencadenantes de dolores. Desencadenante is a really long word, and it means triggers. So avoid the triggers for headaches. Cafeína, caffeine. Alcohol, alcohol. Tabaco, tobacco. Mucho tiempo de pantalla, a lot of screen time. Música fuerte, loud music. Y falta de dormir, and lack of sleep. Okay, amigos, preguntas. If you have questions, that's it for today. But if you've got your questions, we would love to answer them. So post them in the comments section down below. Gracias por aprender español conmigo. Juntos mejoramos comunidades. Para más español, head over to the website, commongroundinternational.com. And if you'd like to take a free medical Spanish test, head over to Certified Spanish, create your free account, and you can take as many free medical Spanish terminology tests as you would like. Okay, amigos, hasta luego. Ciao.